am Claire Romansky. Thank you for joining the virtual 2020 Georgetown Pediatrics Gala. I would not be here today if it weren't for the extraordinary team of doctors and nurses of the Department of Pediatrics that saved my life 16 years ago. It's because of them I am here today in my dining room in New York City, and I'm able to continue living the life I've always wanted to. I have gone through this life with an unwavering comfort, knowing that MedStar Georgetown University Hospital and these doctors and nurses have always had mine and my family's back. I am forever grateful to Georgetown Pediatrics for everything they have done for me and my family, which is why I am happy to be with you today. I hope you feel moved to support Georgetown Pediatrics and the incredible essential staff and programs. At any point in the program, you can use the donate button located on your screen to make a contribution. Now, I am pleased to welcome Dr. Michael Donnelly, Chairman of the Department of Pediatrics.
Thank you, Claire, for honoring us as our MC. I'm thrilled to have you join us once again, especially knowing that you are healthy and thriving. And to all of you, welcome to the 21st Georgetown Pediatrics Gala. I'm delighted that you have chosen to be a part of this exciting virtual event. This year brought unique challenges, opportunities, and a wide spectrum of emotions to our world as we experience this unprecedented public health crisis. I'd like to take a few moments to share how the Department of Pediatrics at Georgetown has demonstrated incredible commitment and compassion during these challenging times. I'm so proud to lead the dynamic team of healthcare professionals in the Department of Pediatrics. Their grace, energy, and selflessness has been on display each and every day of this pandemic. This resourceful team quickly adapted to the challenges they faced, ensuring that essential pediatric operations and critical vaccinations were maintained. They embraced a rapidly evolving virtual platform for telehealth e-visits and worked to ensure enhanced patient and worker safety in our clinical environments. Our hospitalists and NICU teams worked tirelessly to serve our pediatric inpatients and newborns. And we were delighted in August to open the new state-of-the-art Michael Smith Liss and Lauren Elizabeth Lamb NICU Family Support Center. One thing these past few months has taught me is that everyone here at Georgetown Pediatrics, the doctors, nurses, and support teams, are essential. These frontline workers supported the COVID-19 initiative at MedStar Georgetown by volunteering for extra duty, accepting deployment to high-need areas within the hospital, and reaching out into the community, forging unique partnerships to create new and exciting programs to address health disparities in practical and meaningful ways for the children and families we serve. I know they stand ever ready to respond to the challenges ahead. The work we do for the families and children we serve could not be accomplished without you, our dedicated friends and sponsors. Year after year, your generosity has demonstrated that you care for our most valuable resource, the children of our community. I am profoundly grateful to our honorary gala host and presenting sponsor, His Excellency Sheikh Meshal bin Hamad Al Thani, Ambassador of the State of Qatar to the United States, for his continuing commitment to the department and the embassy's extremely generous support of this event. I would also like to recognize the significant support of Rethy Technologies, returning once again as a champion-level sponsor. And I extend my gratitude to Mary Hubler, our gala founder, and to the gala team for their efforts in putting this virtual event together. I would be remiss if I didn't say a heartfelt thank you to our board members who have been such strong advocates for what we do. I'm thrilled that during this event, you'll have the opportunity to meet some of our pediatric team and hear firsthand about their exciting work on the front lines. Once again, thank you for joining us and for your steadfast support of Georgetown Pediatrics. It is now my pleasure to introduce Mike Sachtleben, President of MedStar Georgetown University Hospital.
Hello, my name is Mike Sachtleben, and I serve as president of MedStar Georgetown University Hospital. And I am honored to be part of this very special virtual Pediatrics Gala. Before I begin my remarks, I want to extend my sincere thanks and appreciation to Ambassador Thani and the Embassy of the State of Qatar for their continued support of the Annual Pediatrics Gala. We are deeply grateful for the extraordinary commitment you have demonstrated to our pediatrics department and to our hospital as a whole. I also want to give special thanks and recognition to the members of our Pediatric Advisory Board for their steadfast support of the department and the gala, as well as their overall support for MedStar Georgetown. Your ongoing support is deeply and greatly appreciated, and it helps guide the Department of Pediatrics as it continues to grow and serve the needs of children and families in our community. As you all know, the COVID-19 pandemic caused significant challenges to our organization and to this region. I'm so proud of our pediatrics team who stepped up in so many ways to help us through this unprecedented pandemic. Many of our doctors, nurses, and support staff willingly redeployed to assist other departments in the hospital during the height of our pandemic response. This was a phenomenal display of teamwork and is certainly indicative of the strength and the commitment of our pediatrics department. Another important part of our COVID-19 response was the vast expansion of our telemedicine capabilities. We very quickly implemented this new technology to support the continuity of care with our pediatric patients, offering telemedicine appointments, and our providers adapted so well to this new model of care. I also want to highlight our community pediatrics team, which has remained hard at work during this pandemic. They have put up strong emphasis on mental health and nutritional needs in our community, while also helping families cope with the challenges of quarantining. And most recently, our neonatal intensive care unit celebrated a major milestone with the opening of the Michael Smith List and Lauren Elizabeth Lamb NICU Family Support Center. This newly renovated center, this beautiful center, gives our NICU families a comfortable space to be close to their infants and medical teams while at the hospital. We are extremely proud to now offer this modern amenity to our NICU families. And finally, I am pleased to report that the construction on our medical surgical pavilion is going very well. The new pavilion will feature again 156 private patient rooms, a new emergency department, a rooftop helipad. Above all, the pavilion will have a warm and welcoming atmosphere for patients and families and be a world-class facility to match the world-class care that we provide. I want to thank everyone in our community for their support of this major construction project. So in closing, I want to thank our entire pediatrics department for their unwavering commitment to caring for our patients and their families, especially during the COVID-19 pandemic. And I want to thank you all for joining this virtual gala as we celebrate and we recognize the meaningful ways that our pediatrics team improves the lives of those who entrust us with their care. I wish you all well and good health as we remain strong during this challenging time. And I want to extend my sincere gratitude and thanks to all of you for your support. Thank you.
Thank you, Mike, for your kind words and for your leadership during these challenging times. It is now my privilege to welcome our honorary gala host and presenting sponsor, His Excellency Sheikh Meshal bin Hamad Al Thani, Ambassador of the State of Qatar to the United States, to our event. Ambassador Al Thani and the State of Qatar have been steadfast supporters of Georgetown Pediatrics and our annual gala. Their generosity allows us to engage in many innovative and impactful initiatives. We celebrate our shared commitment to advancing healthcare for children, accelerating research and science, and educating the next generation of physicians. Please join me in welcoming His Excellency Sheikh Meshal bin Hamad Al Thani.
Distinguished guests, ladies and gentlemen, thank you for tuning in tonight. It is a pleasure to see that so many people remain dedicated to supporting the good work of Georgetown Pediatrics and are unwavering in their determination to ensuring access to quality health care for kids, especially during these unprecedented times. Throughout this pandemic, Georgetown Pediatrics has continued to care for the children of our community, while also providing over 10,000 meals and 150 care packages to families in need. The expert doctors, nurses, and support staff who work here are among the true everyday heroes who have sacrificed so much in silence for the service of others. I wanted to take a moment to say thank you for what you do. Georgetown Pediatrics' model of compassionate medicine, where patients and families are encouraged to take an active role in the healing process, is what inspires me to continue to stand behind this organization. The work they do is invaluable to our community and to the lives of so many children and families in the district. Thank you all for your continued and generous support of this amazing institution, and I wish you all a great evening and good health.
Thank you, Mr. Ambassador, for your eloquence and tremendous support of the department and this gala. We'd like to share how the Community Pediatrics team expanded its outreach in school-based health programs and addressed food insecurity challenges compounded by the pandemic. Joining us to moderate a panel discussion is Richard Louie. Richard Louie is a veteran and award-winning journalist, currently news anchor for MSNBC and NBC News, and previously at CNN Worldwide. He is a caregiver for his father and celebrity champion for the Alzheimer's Association, ambassador for Bright Focus, and caregiving champion for AARP. Welcome, Richard. We're so glad to have you with us for this discussion.
Thank you so much, Claire. I am certainly pleased to be here with you. And joining me remotely are several members of the dynamic team from Community Pediatrics. I want to welcome Dr. Janine Rethy, Division Chief of Community Pediatrics at MedStar Georgetown University Hospital. Also with us is Dr. Maria Aramburu de la Guardia, Medical Director of School-Based Health at Roosevelt Senior High School, and Nichelle Johnson, Ronald McDonald Care Mobile Focus on Fitness Program Coordinator. Welcome to all three of you. How are you doing?
Thank you, Richard.
Thanks for having us.
Thank you.
You betcha. So let's get straight into the great work that you three are doing and that you're seeing, and that you try to share with us your point of view, right? Really your world. And so please do give us that sense if you can. Dr. Rethy, let me start with you on this. When you are looking at your work, how did the pandemic increase the needs of the patients and the families that you have seen so far?
Yeah, just to give you a little bit of a sense, Richard, thanks again for having us, about the work that we do here in the Division of Community Pediatrics. So we have been serving the community of Washington, D.C. for 28 years now. And through all these times, we have been committed to providing evidence-based, holistic, comprehensive, and coordinated healthcare for those kids in D.C. who need it the most. And so in a broader sense, we really are committed to attaining health equity within our city here in DC, and really with the goal of ensuring that every child has the opportunity to thrive and be healthy. And so we've built our division over all of these years with that in mind, and we operate three main service lines. The first one is our Ronald McDonald Care Mobile Kids Mobile Medical Clinic. And with that, we provide comprehensive medical services on our mobile unit right in the communities and neighborhoods in which our families live. And the second is also in partnership with Ronald McDonald House Charities, and that's our Fitness Care Mobile. And for that one, we partner with local schools here in DC to provide nutrition and physical education, programming and capacity building, as well as obesity screening and intervention for families who live in the community. And our third main line is our school-based health centers. So we operate two school-based health centers here in DC, our Anacostia High School in Ward 8 and Roosevelt High School in Ward 4. And these clinics are full-service primary care facilities that operate right in the school buildings themselves. So the students in the schools have year-round access 5 days a week to comprehensive primary care services. And so, you know, when the pandemic hit, we were really poised to be able to respond because we already have long-standing relationships with our families in the community. And we operate, you know, we provide place-based care. And so our families know us well, we know them well, and we are really poised to be able to respond to some of these increased needs that our families are facing. Just to give you a sense, you know, in DC, we have tremendous health inequities to begin with and financial inequities. And so when COVID hit, these inequities really became exacerbated very quickly, as we saw here in DC and around the country. So these are things like food insecurity, financial instability, kids who had existing learning disabilities and chronic diseases. These kinds of things became sort of exacerbated very quickly at the early stages of the pandemic.
Well, let's continue on that topic, that third area, that third competency that you were discussing there, Dr. Rethy, and I'll go over to you, Dr. Aramburu. What are you seeing? What have you seen from those students, from those adolescents that are accessing your services?
So thank you, Richard. Thank you for having us. So during the pandemic, definitely we have always been an adolescent-centered, you know, accessible clinic inside the school for them. And it's a place where they feel comfortable and feel like they can access care. So we have seen definitely, as we know, for the last 20 years, increase in mental health issues among teens and youth and pediatric population. In the last 20 years, it has increased from 7% to 19%. And it's estimated that around 20% of children need mental health already as baseline. So you can imagine with the COVID pandemic, this has all been exacerbated because there's a lot of anxiety, you know, towards this uncertainty, and they're outside of their normal environment, going to school,
right.
New challenges at home, such as, you know, food insecurity, family stressors. So this has definitely is still being studied, the exact numbers, but this has definitely increased the need for culturally competent, adolescent-centered services that are accessible. And we're trying to do just that by expanding our services to the virtual world by doing telemedicine and reaching these students where they are, in their homes or wherever they are, we're still reaching them.
Have you been able to keep up, Dr. Aramburu?
Well, we every day we're working hard to keep up with the need. It's a work in progress. We had designed, as Dr. Rethy mentioned, the school-based health center is a full-service pediatric clinic that's inside a school. And before the COVID-19 pandemic, we had designed a mental health clinic, wellness clinic, where we had integrated mental health into primary care. So we have the pediatrician or primary care provider collaborating with the therapist, the psychiatrist, and other ancillary services such as case management, social worker, and well-being activities such as yoga, mindfulness, and fitness. So we're our goal right now is to make sure all of these students and our patients that have mental health needs have this accessible at their fingertips, at their homes. And we're still open in the school-based health center, even though there's school closures, so we can keep providing preventive care such as vaccines, you know, well child physicals, risk assessments, reproductive care, pregnancy prevention, and particularly mental health has been our focus for sure.
Nichelle, it was brought up by Dr. Rethy as well, intimated by Dr. Aramburu, and the word insecurity, right? And an unfortunate reality that we've seen get exacerbated, one of many, right, Nichelle, is food insecurity. So as the program coordinator and family navigator here, what have you seen, and what's being done? I know you've got some numbers because you do watch that in terms of meals given out. Talk about that for a bit.
Yeah, so thanks, Richard. So what we've seen since the start of the pandemic, most of the families that we serve are food insecure. But what we saw at the onset of the pandemic was that families were having an even more difficult time accessing the foods that they needed. If they did get to a grocery store, because so many individuals were going and literally just buying stuff off the shelves, by the time our patients and their families were able to get there, there was nothing there. So we found that families were missing meals, adults were missing meals so that the kids could eat. And so we found that there was really a gap for us to fill in that. And what we've been able to do through our emergency food relief with the pandemic is we've been able to provide well over 14,000 meals to about 40 families. And that's been roughly about 1,420 meals a week that we've been able to serve to our families, which has been a big, big help to them. And it's been a combination of not just hot meals, but also grocery staples. So they've been able to receive things such as chicken, eggs, butter, milk, rice, pasta, things to help supplement their pantry during this time as well.
Nichelle, what does it mean to these families? What does it mean to these adolescents? What are they telling you?
So they're telling us that they have appreciated this above and beyond, just to know that they were being thought of, that we were thinking of them beyond their primary care, that we were actually concerned about them as a whole, knowing that they did not have much to eat or were struggling to find things to eat, and healthy items as well. This has been a big help. It's taken a lot of stress off of our parents and our families as to how they were going to put meals on the table, how they were going to provide food. So we've really been able to fill a gap. They've been very appreciative to our partner organizations as well, and just how they've stepped up to help out. But it's been a major stress relief, being able to know that they have additional hot meals as well as groceries throughout the week.
Dr. Rethy, you work on a space that is, its goal is to do exactly what we've just discussed in the first 10 minutes, right? But now you're asked to do it at a level and at an extreme that you probably always wanted to be able to do, but you may not have planned for, which is totally fine because nobody was necessarily ready for, such a high demand. How do you put that all together when we look about the insecurities discussed so far by Dr. Aramburu and by Nichelle? How did you put it together, and how did you pivot to get to where you are today? Now, what, 6, 7 months in, right?
Yeah, so our approach all the time really with our families is one that we understand that the child does not live in isolation. And so as pediatricians, again, our goal is to make sure that child is healthy and thrives. And so if we view them in that role, that the child lives in a family and that family lives in a community. And so our model all along is really to make sure we're partnering with that family and with that community as we're trying to have that child be as healthy and happy as they can. And so our model, sort of understands the fact that there's lots of other things going on, even in the best of times in all children's lives,
Right.
that affect their ability to be healthy. And those other things, which we call the social determinants of health, are actually more important as far as the health outcomes to that child than their genetics or the health behaviors. And so this was already built into our model in community pediatrics. And so we screen for social determinants of health at every wild child checkup, as well as mental health for both the parent and the child. And so we had a team set up in place before COVID hit with that model in mind. So our team is larger than just the physician. Our team includes a social worker. It includes partnerships with the Medical Legal Partnership, the Health Justice Alliance. And so we can address these needs as part of the child's ongoing health. And
I'm sorry to interrupt, but I wanted to ask you, what was the low point? What month was it? And based on what you learned from that low point, and I mean it in a positive way, as you understand, because so many needed your help and you were able to provide it, and it probably was the most difficult for you. And 2, what does that mean for the new model, right, for community pediatrics? What's changed in what the ideal model might be? If you could do that in a minute for me, Dr. Rethy.
Sure. So, when everything shut down back in March, I mean, it was a huge shock for the whole community and a shock for our practice as well. So how can we continue to take care of these children and their families when schools had shut down, basic services had shut down, and these are vulnerable families to begin with. So having limited access to transportation and limited access to resources, as Nichelle described, and some of the kids were relying on school nurses to receive their medications, and all of a sudden everything shut down. And so again, we kind of jumped into action and kind of shifted a little bit of what we were doing and had more of our team really involved in this family navigation, which Nichelle was describing, helping families connect to resources that they need and helping them have their basic needs met. And we were doing that in sort of a smaller way prior to the pandemic. And the pandemic kind of just pushed us suddenly to be able to do it in a better way. So we picked up telemedicine really fast. We started being able to transport our patients to other locations since our mobile medical clinic had to be pulled off the road due to the risk of the pandemic. And then we were able to, partner with fantastic organizations like No Kid Hungry and Power of 10 and get these families these basic needs, such as food that Nichelle was describing. But along with that came extra support. So family navigators just providing that support and that care for families to respond. And now we're realizing that we can do this. We can continue to partner with these fantastic organizations and meet these broader needs of the families, these social determinants of health, mental health needs in ways that we hadn't thought possible before. And COVID just kind of pushed us to reach that next level.
Exactly.
And we have had fantastic partners along the way. And also looking forward to our next steps as we, this pandemic is continuing for sure, but continuing to take care of our families in this sort of next level up.
Bravo. Dr. Aramburu, what's your proudest moment in the last 7 months? And I know you got many, because as Dr. Rethy was discussing, it got tough, but you got tougher. What's your proudest moment?
Well, I always relate my success to, patient outcomes. If the patients I'm seeing they're progressing and they're improving, that's the best reward that I can have. And I think, realizing that we could, launch telehealth and continue to see these patients in the comfort of their home, especially for mental health, because we were running this mental health clinic, every Wednesday, and we had, pediatrics, psychiatry, therapy, everything at their fingertips. They walk down from their classroom, they have us there. So being able to scale this to telemedicine and still keep the care coordination that we were doing, meeting with the therapist and making sure that we were addressing needs for patients that either contracted COVID or have a family member that contracted COVID. And we had some patients that even starting the pandemic, they weren't doing so well with their mental health. And just my proudest moment was basically seeing one of these patients that was in a really low place. Pre-pandemic, I was really worried about how she was going to do throughout all this time. And I was transitioning her to go to college in September. And I didn't know if we were going to make it there, because she was really, really at a low point. And just recently, a week ago, I got a letter from her, and I can read it to you because it was really moving. And she said, I am so happy and grateful to have met Dr. Aramburu. I have decided to be a nurse after gaining control of my mental health issues so I could meet wonderful people like Dr. Aramburu someday. She has showed me that there is in fact a chance for everyone. And that really, impacted me because she didn't think there was a chance for her in this world. And now she wants to become a nurse. And we have managed to, with the help of all of our team and our professionals, get her mental health under control by weekly visits via telehealth. Practically these teens miss less appointments now because even if they are not going to school or they're not feeling that well, they can take an appointment in their house. So I think that has been a great benefit in terms of reaching our teens.
I think you can retire now, Dr. Aramburu. Hey, Meshal, how about that? She dropped the mic, didn't she?
She did drop the mic.
That story. You've got stories too. So give me one, Nichelle. Talk about the Power of 10. Talk about No Kid Hungry and Georgetown, that collaboration. And what was one of your proudest moments about the way this worked so well?
So it has been truly a privilege to have partnered with No Kid Hungry and Power of 10 for our emergency food relief. Both organizations literally jumped in deep feet, into the deep waters with both feet, ready to meet the needs of our patients and families. And it's so easy to work with both. Chef Eric Brunner Yang, who is the head chef of Makedo and the organizer of Power of 10, he's been so willing to meet the needs of our families to the point where he's even tailored meals. If a family didn't necessarily like what was being made, he would literally find out what it is that they wanted to eat. And then he made sure that he would tailor those meals to him. Mind you, he's making over 1,400 meals a week, but he would tailor meals for families specifically to make sure that not only were they receiving food, but that they would be able to enjoy the food that they were eating. And just the response back, they felt it was such a personal touch that of all the folks that he's making meals for, that he would take the time to cater the meals to our family. It went above and beyond. And it's truly been an honor. And just knowing that we are literally filling a gap, we're meeting a need, and we're taking a stress off of our families has been a tremendous reward.
How have the families done during, because we add in the other layer of what was initially COVID, and then we added in all of this discussion about families of color. And so for those families that you've been able to reach, talk about that really quickly, Nichelle, about that element too.
So actually the majority of our families are families of color that we've been able to reach through this. Many have been, afraid of COVID, afraid of its effects, knowing that it was disproportionately affecting the African-American community and communities of color. So just knowing that they did not have to make additional trips out to a grocery store to be exposed by receiving the meals was very helpful. So in terms of that respect, we've been glad that we've been able to help relieve that stress or some of that fear that our families were experiencing as it relates to the pandemic.
Well, hot dog, I am inspired by all of these stories. Dr. Rethy, you're obviously very inspired by these stories. You know them directly. I'm hearing them for the first time. What does this mean for the future of what you are running, this division, for the idea here of community pediatrics? What's going to be like in a year or two?
Yeah, so in our division, I'm very proud that our whole team, and you've heard from two of our members, but really our whole team always keeps the eye on the ball. And the ball is that every child deserves the opportunity to be healthy and thrive. And all of our work every day in our clinical services and beyond are with that goal in mind. And I'm really, really happy that during COVID, our whole team was able to step up. I know it's difficult for our team as well to get through this crisis. Oftentimes their own health is on the line as well. Seeing patients and delivering the meals. And I think for our whole team to know that we can come together like this, we have the skills, we have the heart to be able to help our patients has been really inspiring for me as a leader. I'm not surprised at all by our team, but we've been able to really deliver for our patients. And then to have some of that feedback from our team, from our partners, and from our patients of how much this kind of support has meant to them has been just very gratifying. And this is the reason why we go to medical school. It's the reason why we do what we do, is to be able to make a difference in families' lives, and particularly in times of stress like this. This is kind of what we're put on the earth to do. So I'm very, very proud of our team.
Every evening I would walk out into my patio and scream and holler every night and clap. But now I get to do it here with the three of you and talk loudly and clap. So thank you for what you've done. I have now read the Hippocratic Oath about 5 times just to understand the very existence of people like the three of you and why you do what you do as a journalist. I've told your stories many times, and so as a journalist, but now today as a citizen of this great country, thank you for what you've done. And I'm glad you're remaining safe and that you still remain inspired. So thank you all three. Thank you, Dr. Rethy. Thank you, Nichelle. Thank you, Dr. Aramburu. This has been a very enlightening for me personally discussion on community pediatrics. Go get them, as they like to say.
Thank you, Richard.
Thank you.
Thank you.
Now I'd like to share with you a look at the important field work that is taking place with the Emergency Relief and Nutrition Program. Chef Eric Bruner-Yang, restaurateur and Power of 10 founder, and Karen Gremont, director of Early Childhood Center for Best Practices at No Kid Hungry, have been integral partners in this work with the community pediatrics team. Now let's hear what they have to say about the impact this program has for families facing food insecurity during the pandemic.
So No Kid Hungry has been working for decades to end childhood hunger, and we've made amazing progress. Before the pandemic hit, 1 in 7 children across the country was struggling with food insecurity. In the last 6 months alone, we have seen those numbers change drastically. we're now looking at 1 in 4 children across the country struggling with food insecurity. So as we looked at that and came to understand the gravity of what children across our country were facing, we looked to partners that could help us on the ground address this directly. And we started with our amazing network of chefs who have been alongside us and our mission as supporters and our cheerleaders for this work for decades. And Chef Eric Brunner Yang and his amazing Power of 10 initiative immediately came up as a partner. And then we turned to Georgetown Community Pediatrics.
So we started the Power of 10 initiative, which the idea is to raise $10,000 a week to create 10 full-time jobs, which could then create 1,000 meals and that model would work anywhere in the United States. And we started first here on H Street with our neighborhood restaurant Kane, which is on 5th and H. And since then we've supported 40 restaurants, raised over $1 million and served 200,000 meals. And one of the catalysts to really kind of like legitimizing us as a nonprofit was our partnership with Georgetown Pediatrics and Share Our Strength, No Kid Hungry. And we've been really excited to support the 40 families throughout the summer. And we look forward to help them through the rest of this year and into 2021. Specifically for this program that we did with Georgetown Pediatrics, for people that are watching, what we were doing was we were essentially providing meals for families every day, so they didn't have to worry about where their food was going to come from. They didn't need to go to the grocery store, they didn't need to go to a food bank, they didn't need to go to a pickup or drop-off center. Once to twice a week we would literally deliver every single box to every single home, just to be able to provide the comfort and the time to allow them to focus on other things. A lot of these families have multiple children or elderly in their home, single parent families, so it's like they don't really have the time to cook and the time to focus on anything except trying to keep their families together. To do that was thousands, literally thousands of meals every week. I think that people that we're supporting needed the support pre-COVID, they're gonna need the support during COVID, and they're gonna need the support after. And I think, poverty charges interest, it compounds and compounds and it gets harder and harder. It doesn't get easier and easier unless there are people that are willing to provide a more human experience to it. And I think that's really what we did. It was just allowing people to have time to be more human versus feeling like, they're in this program and it's kind of suffocating them, right? Where it's like, I gotta take 3 buses, I gotta figure out how to take my kids there, I gotta do this and I gotta do that. This was just we're gonna bring it to you and have the freedom to figure out what's, how you're gonna continue to move forward. And I think that's what was really special about that.
So working with MedStar Georgetown has been great. The relationship with the navigators is, I think, the most important component of our delivery routes, because we don't overstep our boundaries with the families. If there's a meal adjustment or if there's a change in the household, the navigators communicate it with us and they communicate with the families. It feels great. I mean, we've never, other than doing charity events, we've never been boots on the ground as far as with food to families in need. So I think COVID made us relook at what we need to do as far as to help our community. And it's just been rewarding to see the families actually enjoy the meals, and especially the kids, to be able to see them enjoy the meals as well.
I am so grateful for the tremendous generosity of the AJ and Alice B. Clark Foundation, the J. Willard and Alice S. Marriott Foundation, and No Kid Hungry and Power of 10, who have partnered with us to continue and expand this work. We have a shared vision in this community to ensure that every child has the opportunity to be healthy and thrive. Together, we believe the possibilities for the future are bright.
It's clear, community pediatrics is doing essential, hands-on work that has a direct impact to help kids and families thrive. As we've just heard, the challenges that the pandemic has presented have touched our community in a multitude of ways. We are pleased to now have Dr. Donnelly outline for us a new groundbreaking research initiative in the department and share how each of us can stay safe and healthy as we navigate the ever-changing landscape created by the COVID pandemic.
Now, I want to share some very exciting work happening at Georgetown University and want to highlight who is making this research possible. The research is being conducted within the Department of Pediatrics and is generously funded by an incredible philanthropist and entrepreneur, Mr. Dan Mishra. Mr. Mishra has a long history focusing on advancements in science and technology. We are deeply indebted to Mr. Mishra for his amazing support of this critically important work. This is revolutionary research in immunological science, looking at how the bacteria in the gut affect the health of the whole individual, including how it can affect rates of illness such as sepsis in babies, or even cancer and obesity rates in adults. Through an extraordinary donation, we were able to hire a world-renowned researcher, Dr. Pinaki Panigrahi, to our institution to continue his work in this field. This work in bacterial immunology got started right before the world became focused on the immunological issues around viruses. The COVID-19 pandemic has impacted all of us in so many ways. I'd like to take a few minutes to answer some questions about COVID-19. First, what is the current state of SARS-CoV-2 across the country? It's very likely the cases will bounce up and down for months. Yes, a vaccine may help, but it's not the end-all be-all. Here at home in the DC and Baltimore region, we're seeing that in adults who have no symptoms, 2% of these patients test positive for COVID. Amongst adults with symptoms, about 10 to 15% are positive, and a little less in children. Yes, children do get sick. Yes, they can spread it, but they don't get sick as often. College students are proving to be good at spreading the virus. If you send them off to school, you may want to take certain precautions before bringing them back home. I actually had an adult patient who ended up in the hospital after his son came back from college. So it's important to have them get tested or quarantined prior to coming back home. So, what can we do to stay safe? Well, there is no magic. It all goes back to simple physics, space and time in practical terms. Anything is possible, but proximity and ventilation are what matters most. So wear a mask. A high-risk exposure, which is considered 15 short minutes with no mask and someone standing less than 6 feet away, has about a 50-50 chance of spread. But I wouldn't stand 7 feet away from someone upwind who's shouting either. Not a good idea. You are safer outside than inside, so when choosing activities like dining out, opt for eating outdoors. The vast majority of cases are likely spread via droplets, although some are likely via aerosol or by touching a surface. We hear these terms, but what do they mean? What is the difference between droplet and aerosol spread, and why should it matter to you? A droplet has water molecules. Aerosol doesn't. So droplets drop, and the bigger they are, the faster they fall. Aerosol is minuscule comparatively and can float in the air, sometimes for hours. So while it's probable that there is some aerosol transmission, the vast majority is droplet. So current CDC guidelines, especially about masks, are very reasonable in my mind. The key is avoid the 3 C's: closed spaces, crowds, and close contact. Most importantly, what do you need to do to stay well? Most healthcare providers have seen increases in anxiety and depression, and there are reports of increased domestic violence and child abuse. The best advice wellness experts give is to exercise, get out into nature, make sure you're practicing self-care, whether it be yoga, meditation, or any form of relaxation. Also, social isolation is very serious. Make sure you're taking time to touch base with people. Reach out. It really does help. We at MedStar Georgetown University Hospital are here for you. Thank you for the opportunity to talk to you about this very important topic. Stay safe and stay well.
We've heard a lot this evening about how the pandemic has impacted communities and changed the landscape of healthcare as our doctors, nurses, and support staff work tirelessly to respond and provide the best care possible. And now we'd like to hear from some of these heroes that are representing Georgetown Pediatrics.
Hello, I'm Dr. Sejal Babishi. I'm an attending physician in the Department of Pediatrics. During this pandemic, I had the honor of caring and serving for patients diagnosed with COVID-19 as part of the member of the special surge team of the adult internal medicine floors at MedStar Georgetown University Hospital.
I'm Natalie Lima Garcia, nurse manager for the Department of Pediatrics.
And I'm Colleen Kiley, registered nurse for the Department of Pediatrics. Our role during this pandemic was to assist in staffing our occupational health COVID testing clinic to safeguard the well-being of our frontline workers.
We were also pleased to be part of a team to help establish new telehealth platforms for our pediatric outpatient families.
Hi, I'm Derek McKay. I'm a patient services coordinator in Department of Pediatrics. Like Natalie and Carlene, I was reassigned to the hospital to staff the occupational health COVID testing clinic, as well as being part of the MedStar team deployed to the DC Convention alternate care site.
We represent more than 250 physicians, nurses, allied health, and administrative professionals here at Georgetown Pediatrics who have had the privilege of being part of this unprecedented time in healthcare. However, we could not have risen to this challenge without you. Your encouraging words and support, whether it be gifts of food, messages of goodwill and good cheer, and your generous philanthropic donations to our essential programs for frontline workers, have really allowed Georgetown Pediatrics to carry our mission forward for caring for families and children during this time. From all of us at Georgetown Pediatrics, we want to extend a very heartfelt thank you.
Thank you.
Thank you.
Thank you.
Thank you to all these amazing healthcare professionals who are working to keep our community safe and healthy during this challenging time. Listening to all of the speakers, it's clear everyone in Georgetown Pediatrics is essential. They are truly frontline workers. As a former patient of the Department of Pediatrics, I've seen firsthand how these nurses and doctors work day and night to provide the highest standard of care for their patients. To ensure these essential workers have all the tools their programs need, I ask you to consider making a donation. It's very simple. All you need to do is click the donate button that you can see on your screen below. Here you'll be brought to the Georgetown Pediatrics Gala donation site, where you can select your donation amount. Any amount is greatly appreciated. It really does all add up. I have been so honored to be the MC here today. This virtual gala will be posted to the gala website, so anyone who wasn't able to join today can watch the program and make a donation. I hope you'll join us again next year. Please stay safe and well, and be sure to stay tuned for our special thank you acknowledgements.